नेक्स्ट इज अथा तो महावातव्याधि चिकित्सधर्म्याख्यास्यामः यथोवाच भगवान् धन्वन्तरिः. There is a very unique expression in Sushruta about the Vatavyadhi. See, in one chapter, he refers about the general principles of the management of Vatavyadhi, as we have discussed in the previous chapter. There is another chapter separated, which is named as Mahavatavyadhi, and that kind of an expression of a Mahavatavyadhi is unique concept of Sushruta. Charaka Samhita does refer the word Mahavatavyadhi, but not in the same sense as that of the Sushruta Samhita. In Charaka Samhita, it's just suggestive of a severe Vatavyadhi. Whereas in Sushruta, Mahavatavyadhi refers to a few of the selected diseases like Vatrakta and Pakshagata, etc. Only a few of the selected diseases of the Vatavyadhi, which are considered as Mahavatavyadhi. Probably it could be with an idea of the poor prognosis and possible severe complications, such conditions, and they are categorized as Mahavatavyadhi. And among them, the first one is Vatashonita or Vatarakta. द्विविधं वातशोणितम् उत्तानम् अवगाढन्ते इत्येके भाषन्ते तत्तु न सम्यक् तद्धि कुष्ठवत् उत्तानं भूत्वा कालान्तरेण अवगाढी भवति तस्मान्न द्विविधम्. Now, Sushruta's view of Vatarakta is different from slightly different from the view of Vatarakta in Charaka Samhita. In Charaka Samhita, it's suggestive of more of a joint disorder, whereas the Sushruta's concept of Vatarakta is suggestive of an abnormality related to the circulation of the Rakta. And so there is a slight difference of opinion. In other Samhitas, Vatarakta are categorized into Uttana and the Gambhira, whereas Sushruta says that it's not that two types of Vatarakta, but these are the two stages of Vatarakta. Like initially it will be Uttana, superficial or mild, and then it becomes Gambhira. So it's a course of the disease. Uttana and Gambhira are considered as the two stages of the disease, not two types of the disease according to Sushruta. Of course, in Nidhanasthana we have referred to these issues once. Now the same thing is repeated about the etiological factors as well as a bit of the clinical symptoms. तत्र बलवद्विग्रहादिभिः प्रकृतस्य वायोः गुरु उष्ण अध्ययनशीलस्य प्रदुष्टं शोणितं मार्गम् आवृत्य वातेन सह एकीभूतं युगपद वातरक्तनिमित्तां वेदनां जनयति च वातरक्तं तत्तु पूर्वं हस्तपादयोः अवस्थानं कृत्वा पश्चात् देहं व्याप्नोति. The etiological factors of Vatarakta are due to maybe a stress of physical stress of maybe fighting with another person or rigorous activity or trauma to the body. With that, when there is those who tend to consume more Ushna Ahara or those who consume more food than what's necessary, Adhyashana Shilasya, that's Adhyashana is where they take excess of food. The vitiated Vata would be producing the blockage to the channels of the blood, Shonita, and hence it's obviously vascular disorders. Obviously, whatever Sushruta has mentioned is about the vascular disorders. Tat hastapadayoh avasthanam krutva pashchat deham vyapnoti. Most of the times, the primary site of the lesion would be in the periphery, extremities, and then it may involve other proximal lesions. This also is true in case of vascular disorders. And certain of these facts we have discussed in the Nidhanasthana when we discussed about the Vatavyadhi Nidhana. Pururupani Toda Daha Kandu Shoka Stamba Pakparusha Sira Snai Dhamani Spandanam Sakti Dorbalyani Shava Aruna Mandalotpatisha Akasmata Panipadatala Anguli Gulfa Manibandha Prabdisho तत्र अप्रतिकारिणो अपकारिणश्च रोगो व्यक्ततरः तस्य लक्षणं मुक्तं तत्र अप्रतिकारिणो वैकल्यं भवति. The Pururupa, again these also are discussed in the Nidhanasthana and hence is a bit of repetition. It will be like burning sensation, pain, itching and so on, or even the swelling, numbness, and Sirasnai Dhamani Spandanam. the abnormalities of the pulsations, peripheral pulses. Now that's a very important clinical sign of the peripheral ischemia. The conditions where there is a abnormality of the pulsation seen in the periphery is definitely, obviously, it's related to the vascular disorders. And Shava Aruna Mandalotpattihi, there could be patches, reddish patches. Now, reddish or bluish patches are often seen in case of the vasculitis, minor vessel disorders. The vascular disorders could be minor vessel disorders or major vessel disorders, and the major vessel disorders you have venous as well as arterial disorders. All the three are considered as a Vatavyadhi, whereas now in the present day situation we categorize them separately. The vasculitis where the minor vessels are involved, and then of course in the vasculitis you may have still capillaries and then the venules involved, or what we call as moderate vessels involved, and then the major vessels, particularly veins and the arteries involved. So you will have categorization like the venous thrombosis, varicosities, etc. Whereas in the arterial disorders, mainly there is a thromboembolism or thrombosis, vascular arterial thrombosis, arteritis. All such categories of the diseases can be considered as a Vatarakta. Prashas Sukumaranam Michahara Viharinam Sthulanam Sukhinam Tyapi Vataraktam Prakupyate. The incidence of Vatarakta are more in those persons who are bit obese and their body configuration is suggestive of a delicate constitution, Sukumaran, delicate constitution, who are having lesser exercise, and those who consume this improper food, Mityahara Viharanam, improper food, and Sukhinam Tyapi, those who do not do exercises. Such are the incidences as such, and this also is true in case of the vascular disorders. Tatra Prana Mamsa Kshaya Pipasa Jwara Murcha Shwasa Kasa Stamba Arojaka Avipaka Visarana Sankochanehi Anupadrutam Balabantam Atmavantam Upakaranavantam Chupakrameta. The Asadhya Lakshana, incurable signs are when there is a reduced vitality, Pranamamsa Kshaya, the vital functions are reduced, or patient who have the signs of toxemia, Pipasa, Jara, Murcha, Shwasa, Kasa, these are the signs of toxemia. Or when there is a systemic involvement, multiple systemic involvement, where Arochaka, Avipaka, etc. Or Visarana, where there is a tendency of a fast spread, a vascular lesion which is tending to spread faster, or Sankochanehi, the contractions which occur, contractures which occur as such. These are signs of incurability and they cannot be treated. When the patient otherwise physically strong and has a good willpower, and because the treatment involves costly protocols, those who have the sufficient infrastructure, sufficient facilities, they are to be preferred for the treatment. Tatra adaveva bahuvata ruksha amlanangadrute margavarnatu dushta shonitam asakrit alpalpam avasinchetu vatakopabhayat tatah vamanadibihi upakrametu upapadya pratisamstabhaktam vataprabhale puranavritam payet. The first line of the treatment in those conditions where there is not much of a very significant damage to the tissues, in such conditions, Rakta Mokshana is the first line of the treatment. That's in the early stages where there is, Sushruta has very specified Bahuvata Ruksham Lana Angadrute, where there is no signs of atrophy or when the disease condition is not very severe. Only in such conditions, although in the beginning only, Rakta Mokshana is done, and Rakta Mokshana is again done with very little quantities of the blood to be let out, unlike other conditions. So, Avasincheta alpam, avasincheta. The Rakta Mokshana has to be done in smaller quantities. And then, Vamanadivyupehi upakramehi. The next is the patient has to be given the Shodhana, Vamana or the Virechana, and after that, all that procedure of Samsarjana Krama, in a Vatavyadhi or Vatarakta, where the Vata Lakshanas are predominant, Purana Grisam Payeta. Purana Grisam means ghee which is stored for more than a year. That's a Purana Grisam. Of course, more than a year or more than 10 years, these are the issues of controversies. The general belief is yes, ghee which is stored for more than a year is the Purana Grisam. Adakshiram va arjatvelam madhukakshayuktam शृगालविन्ना सिद्धं शर्करा मधुमधुरं शुण्ठी शृङ्गाटकशेरुकसिद्धं वा श्यामा रास्ना सुसवि शृगालविन्ना पीलु शतावरि शतंस्र पञ्चमूलि सिद्धं वा द्विपञ्चमूलि क्वाथ अष्टगुणसिद्धेन पयसा मधुक मेष शृंगी शदंस्त्र सरला भद्रलारु वचा सुरभि कल्कप्रतिवापं तैलं पातयित्वा पानादिषु उपयुज्येत. These are certain of the specific food substances or food supplements which can be given to support the general condition, like ajakshiram, that's the milk of goats with taila, half of the taila, and madhuka, that's madhuyasti akshayuktam, and this haritaki, madhuka and haritaki, and so on. So similarly, the combinations of the drugs with the milk, these are the choices, different choices of the kshiropakas which can be given as a food supplement which facilitates the recovery. Then shatavari mayuraka kinihi ajamoda madhuka kshira vidari bala atibala trina panchamuri kvata siddhamva kakolyari prativapam. For the lepa prativapa, the lepa is done with the same drugs, shatavari mayuraka. These are the combinations of these, either the kvata or kakolyari kalka, these are applied over the area, or balatailam shatapakam, balataila, which is processed 100 times. Vatahara mula siddhena payasa parishetanam amla irva kurveta, or with the vatahara dravya prepared milk used for parishetana, pouring over the area. So local treatment of either parishechana or prativapa, application of a thin lepa, or this kashaya is done. Or it could be pradeha. Pradeha is a thin lepa. Yava madhukehi eranda tila varsha bhubirva pradeha karyaha. The lepa is applied over the area. Tatra churniteshu yava godhuma tila mudgamasheshu pratekashaha kakoli, kshira kakoli, jivaka, rishabhaka, bala, atibala, bisa, mranala, shrigalvinna, meshashringi, priyala, sharkara, kasheruka, surabhi, vacha, kalkamishreshu upanahartham. The upanaha with these drugs, kakolyali drugs like, or sarpistala vasamati duktha siddhaha pancha payasaha vyakhyataha. Payasas are done. Payasas are semi-solid substances. It's not necessarily that payasas in Samhitas should have these sweet substances like the sugar or maybe the guda, but not necessary. So it could be like warm, pasty substances are applied so that there is a local effect. Snehika phalasara utkarikava, or to warm, it could be utkarika with the snehika phala, the fruits which have sneha guda. Churniteshu yavagodhumatila muggamasheshu matsya krishna veshavarova, or the other substance which can be used for upanaha could be yavagodhumatila or fish or the flesh of the animals. Bilva peshika tagara devadaru sarala rasna harenu kushtha shatapushpa yela sura dadhi mastu yukta upanaha. Another option of the upanaha. Or matalunga amla saindhava drithamishram madhu shikru moolam alepaha tilakarkova iti vata prabale. Or the other lepa with the matalunga amla siddha or the substances over the area. Pitta prabale, if there is a predominance of pitta dosha, then the drugs selected would be Draksha, Arevata, Katphala, Payasya, Madhuka, Chandana, Kashmiri Kashayam, Sharkara, Madhumaduram Paye, the internal administration of the substances which are Pitta property like Draksha, Arevata, etc. Or Shatabari, Madhuka, Patola, Tipara, Katarohini Kashayam, Guduchi Kashayam, Pitta Jwaraharam, Chandranadi Kashayam, Sharkara, Madhumaduram, Madhura Tikta Kashaya Siddham Vasarpihi, or Ghrtapana with these substances, Guduchi, etc. Of course, practically, when we use now, Guduchi is one of the very relevant substance and quite useful drug in case of management of the peripheral ischemic disorder, peripheral vascular disorders. Bisa Mradala Bhadra Shri Bhadrashriya Padmaka Kashayana Ardhakshirena Parishekaha Kshirekshu Rasam Rasehi Mudhu Sharkara Tandala Utkairva Draksha Ishu Kashaya Mistrairva Mastu Madhya Dhanyam Lihi Jivaniya Siddhena Va Sarpasha Abhyanga Shatasauta Gritena Va Kakolyadi Kalka Kashaya Vipakvena Vasa Pisha. Now for the Parisheka local application or Abhyanga for the application of the other substances, these yogas could be used like. And Shali, Shastika, Nala, Vanjula, Talisa, Shringataka, Shringataka, Galodi, Gauri, Gairika, Shaivala, Padmaka, Padmapala, Padmavatra Prabhuti, Dhanyam Visteha Pradeha Ghramishaha, Vata Prabhulepesha, Sukoshna Pradeha Karyaha. These are the drugs which could be used for the lepa in case of the Pittaja or Pittadika Vatarakta, or the same also can be used in case of Vatadika Vatarakta with the warmth. The preferably majority of the substances used in Pittadika Vatarakta are Shitavirya Dravyas and Pittahara. And for a Pittadika Vatarakta means where there is more signs of local inflammation, these are applied cold. Whereas Vatadika Vatarakta, where there is more signs of neurological irritation conditions like pain and severe numbness, in such conditions, warm lepa is applied. Rakta Prabalepi evam Bhushascha Shonitam Avaseja Shitata Master Pradeha Karyahiti. Rakta Prabala is very acute conditions where there is a rapid progression of the disease of vascular disorders. In such conditions, the same drugs could be used, but they should be Shitatamaha, very cold substances are used there. And Shonitam Bahusha Avaseja, the Rakta Mokshana has to be done more rigorously as such. Shleshma Prabaletu in the Kapadika Vatarakta, where there is a progressive ischemic conditions, slow progressive ischemic conditions. Now, these issues we have discussed in Nidhanasthana, like when to consider Mahavatavyadhi or when to consider Pittadika or when to consider Kapadika Vatarakta. In the Nidhanasthana, we have discussed this in detail, so I will not repeat the same. In case of the Kapadika Vatarakta, where there is a sign of progressive ischemia and gradual adaptation changes, Amalaka Hridra Kashayam Madhu Maduram Payet, Tripala Kashayam Va, the Kashaya to be given internally, and or Madhuka Shungavera Haritaki Diktarohini Kalkamma Sakshaudram, Mutra Toya Anyatarena Gudaharitakam Va Bhakshayeta, either Kalka of those drugs or Kashaya of the drugs, or simply Guda Haritake, Guda and Haritake has to be given. Then Taila Mutra Kshara Udaka Surashukta Kapagnausha Nikwateshtia Parisheka, Parisheka, the Tikshna Dravyas like Mutra Kshara etc. are used, or Aragodadi Kashaya Ushni, warm Kashaya of the Aragodadi Gana, Mastu Mutra Sura Shukta Madhuka Sariva Padmak Siddhamma Gazabhyanga, Abhyanga with the above said yoga. Tila Sarsha Patasi Avachurnani, Skleshmataka Kapitta Madhuchikru Mishrana, Ksharas Mutra Pistani Pradeha, another of the option for the lepa, and Sweta Sarshapakalkaha, Tila Ashwagandha Kalkaha, Priyala Siru Kapitha Kalkaha, Madhu Shigru Punarnava Kalkaha, Vyosha Tikta Prutak Parni Bhrati Kalkaha, Ityajesham Panja Pradeha, Sukhosnaha, Charodaka Pistaha, Shaliparni Prasniparni Bhatyav Shira Pistaha, Tarpana Mishraha. Now, the local application. So, in majority of these situations, now the first set of the approach in all types of Vatavyadhi or Vatarakta, particularly all types of Vatarakta, local application is given priority by Sushruta. Rakta Mokshana is indicated with the specific precautions, and internal administration of food supplements is the main course of the treatment, along with the specific aushadis also are mentioned. Sansargya Sannipatecha Kriya Patham Uktam Mishram Kuriyat. When there is lakshanas of more than one doshas, the combination of these have to be used. Now, specific yogas or drug, medicinal uses which are suggested in Matrakta are Sarveshta Guda Haritakim Aseveta. Guda Haritaki is of course, in the initial stages, it is suggested as a option in case of the Kapadika Vatarakta, but again, Sushruta repeats the same, like it's not only Kapadika Vatarakta, it can be used in all varieties of Vatarakta, or Pippali Kshirapistaha, Varipistaha, Panchabhivruddhya, Dashabhivruddhya Vapibeta, Pippali, Vardhamana Pippali Yoga. Now, Vardhamana Pippali Yoga. It has many sorts of protocols in different texts. Bhagavata mentions about a different set of the Vardhamana Pippali Yoga, and Rasayana, Pippali Rasayana mentioned in Charaka also says about a different sort of the yoga. Whereas in Sushruta also, in the Rasayana chapter, the Pippali yoga are mentioned in different protocols. In case of Vatarakta, the suggested protocol is Pippali va Kshirapishtaha, the kalka of Pippali with the Kshira or water, and every day it has to be increased by 5 pippalis every day or 10 pippalis every day. That means if it is 1 today, 5 next day, and then next day 15 and 20 and so on. So every day 5 has to be increased till 10 days. This is suggested in case of Vatrakta. Is a sort of one variation of the Vardhamana Pippali. The more of those variations of Vardhamana Pippali and so on we discuss when we discuss the Rasayana Chikitsa later on. Bhuyashta apakarshayat. Similarly, it has to be reduced. Evam tavat panchadashala iti. Tadetat Pippali Vardhamanakam. See, that's about the Vardhamana Pippali yoga mentioned in the context of Vatrakta. ವಾತಶೋಣಿತ ವಿಷಮಜ್ವರ ಅರೋಚಕ ಪಾಂಡುರೋಗ ಪ್ರೀಹ ಉದರ ಅರ್ಷ ಕಾಸಶ್ವಾಸ ಶೋಹ ಶೋಷ ಅಗ್ನಿಸಾದ ಹೃದ್ರೋಗ ಉದರಾಣಿ ಅಪಹಂತಿ ಜೀವನೀಯ ಪ್ರತಿವಾಪಂ ಸರ್ಪಿ ಪಯಸಾ ಪಾಚಯಿತ್ವಾ ಅಭ್ಯುದ್ಯಾತ್. This Vardhamana Pippali is used in many other disease conditions like Vishamajvara, Arochaka, etc. All the diseases, and it's a broad spectrum rasayana. And during this course, you also can have the Abhyanga with the Jivaniya Prativapasarpi, Krita with the Jivaniya Pratyas. Saha Asaha Deva Chandana Murva Saha Sahadeva Chandana Murva Musta Pippala Priyala Shatavari Kasheru Padmaka Madhuka Shatapushpa Vidari Kusthani Kshirapistaha Pradeho Ghasamanda Saireka Atarushaka Bala Atibala Jivanti Sushavi Kalkova Charakshirapistaha Gokshirapistaha Kashmariya Madhuka Tarpana Kalkova Mathuchista Manjista Sarjarasa Sariva Kshirasiddham Pindasailam Abhyangaha Sarveshu cha Purana Ghritam Amala Karsavipakuncha Vapanarte Jivaniya Siddham Parishekarte Kakolyadik Kvatakalka Siddham Va Susavi Kvatakalka Siddham Va Karavelaka Kvata Matra Siddham Va Balatelam Va Parisheka Avagaha Basti Bhojaneshu. Now these are the other protocols which can be selected. It doesn't mean that you have to select all the protocols. Depending upon the possibilities and the condition of the patient, any one of these protocols can be used. Then the pathya, the general food would be Balatailam Parisheka Avagaha Basti Bhojaneshu. Balataila can be given as food supplement. Shali Shastika Yavagodhamam Annam Anavam Punjita. Now, boiled, stored grains of Shastika Shali or Yava Godhuma, these are to be used. Paisa Jangala Rasena Mudga Yushanava Anamdena. Shomita Moksham cha Abhikshanam Kurvita. Repeated Raktamokshani is also suggested. Uchita Doshecha woman Abhirechana Astapa Anvasana Karma Kartavyam. All the types of way the Shodhana Kriyas are to be followed. Patola, Tripala, Bhiru, Guduti, Katuka Krim, Kwatham Pitva Jayatya Suvata Shonisyam Dujam. Another of the specific, very powerful yoga according to Sushruta is Patola, Tripala, Bhiru, Guduti, Katuka Krim, Kwatham, the Kashaya of these substances. Bhavanti Jatra, Evamadhi Kriya Yogi, Achirotparitam Sukam, Vatas Satyate Vaidhi, Yapyate Chirottam. With all these protocols, you can treat a patient of Vatrakta if it has come, if the patient has come in an early stage. Whereas if it has become chronic, and then it may not be curable, it may be only Yapya, can be pulled down. Upanaha Parisheka Pradeha Bendrani Sharanani Apravatani Manojani Mahandija Mritu Ganda Upadhanani Shairani Sukanja Vatrakte Prashasanti Gatasumwahananija. The other general protocols of Vatrakta are mainly local, Upanaha, Parisheka, etc. And the patient has to be nursed in a proper, well-ventilated room and all comforts in a comfortable bed. And the patient's psychological issues also have to be considered. Manojnani Mahandi, a psychological counseling may be necessary in such patients because it's a chronic disease and can produce a significant deformity. Vyayam Maitanam Kopam Ushna Amla Lavanashanam Divasapnam Abhishandi Gurucha Annam Vivarjayeta. During the course of the treatment of Vatrakta or even after that, the patient has to avoid rigorous exercises, sexual indulgence and rigorous psychological this stress kopam, and Ushnamla Lavadashanam, food which is of very pungent or spicy food, and Divasapna, sleeping during the daytime, or any efficiently dravya so has to be avoided. Then the next is in the Apadanaka Chikitsa. Apadanaka, again we have discussed convulsive disorders. Apadanikam, Astrastraksham, Avatra Bhuvam, Astadhamedram, Asvedram, Avepanam, Apralapinam, Akhatva Patinam, Abahirayaminam, Chakupakarmita. The signs of poor prognosis are when the patient has a impaired sensory perception. Sastraksha is the akshas, indriyas are not able to perceive as such. Then if there is a permanent deviation of a face or the eyelid, that's where there is a definite palsy, that's also considered as asadhya. And stabdhamedra, if the patient has a persistent penile erection, then too is it's a sign of incurable condition, because it's a sign of sympathetic failure. And the patient who doesn't sweat, or the patient who doesn't have a tremor, so continuous permanent rigidity, as such is a sign again poor prognosis. And pralapinam, the who has irrelevant speech, and khatvapati is who is not able to support himself on the bed, he tends to fall on that, which we call as a writing reflex. Now these again issues we have discussed during the Nidanasthana in the Apadanaka Vyadhi, the possible types of such are bahiraya, there where there is a bending towards the superior side as these are the conditions where its asadhya cannot be cured. In other conditions, prageva sneha bhaktam swina shariram avapidanena tikshnena upakrame dashira shuddhyartam. The first line of the treatment is tikshnasya after the snehana and svedana, and avapidanasya is to be given. Then anantaram bidari gandhadikwata mamsara kshira dasipakvam sarpiracham payet. Then that's during the acute episode, nasya is the preferable route of administration. Then once the patient has recovered from the episode, then bidari gandhadikwata sarpihi acham, the ghrita prepared with bidari gandhadikwata, or tatahi nachimatram mayuh prasarati. This prevents the involvement of other vital organs of the body. Tatra bhadradavadi vatagna ganagam ahritya sayavakolapulabdham sanupa udakamansam panchavargam ekata prakwatya tamadaya kashayam amlakshirehi saha unmishya sarpihi tailavasa madhyabihi saha vipachet madhuraka prativapam tadetat trayvrutam apatanakinam parisheka avagaha abhyanga pana bhojana anuvasana seshu vidaryat yathoktexte sveda vidhani svedayet baliyasi vate सुखोस्न तुष बुष करीश पूर्णे कूपे निदध्यात आमुखाद तप्तायां वा रथकारचुल्यां तप्तायां वा शिलायां सुभरा परिषिक्तायां पलाशदलच्छन्नानां शायेत कृशरा बेशवार पायसे वा स्वेदयेत. Now these are certain of the other options to make the patient recover. So one of them is the Trivrta Ghrita or Trivrta Sneha. Trivrta Sneha, where you use Sarpi Stailavasa, all Sarpi Stailavasa or Majja also have to be used with the drugs which are mentioned, like with Anapaloka, Mamsa, Panchavarga, etc. And it could be or the Svedana. Svedana again, if the patient is physically strong as such, can sustain a stressful Svedana or a very warm Svedana has to be given, and that warm Svedana is prepared by having this a pit formed filled with the tusha, busha, karisha, that the different sorts of the skins of grains or other soft material, and they have to be warmed, and the patient has to be kept in that issue and that pit as such, or taptayam rathakarachulya, or taptayam shilayam, or in a warm rathakarachulli. Rathakarachulli is the instrument which is used for metallurgy, heating the metals. Over that, the patient is maybe made to lay down on a warm table, or it could be over a shila, a piece of stone, which is heated, and then over that you produce this sprinkle alcohol, or and then cover that with the leaves of palasha, and over that the patient has to be made to lie down, or the payasa of Krishara, Veshavara, etc. So, physical stimulus, external stimuli in the form of warmth is one of the options by which the patient can be made to recover from the convulsive stage. Mulaka Urupa, now from the current point of view, how far this will be useful? Questionable. From the current point of view, that kind of a peripheral stimuli in a case of convulsive disorder is generally not suggested as a protocol of the treatment. So controversy is that, but practically these things do help in the patient's recover. That's the other way. Mulaka Urupuka Spurja Arjaka Arka Saptala Shankhini Swarasa Siddham Tailam Apatanakiram Parishekadishu Upayojyam. The parisheka, these drugs are used in the form of taila for the parisheka. Apuktavata pitam amblam dhadi maricha vachayuktam apatanakam hanti. A general advice would be a very sour curds with the maricha, vacha, etc. It has to be given in empty stomach as such. Taila sarpi rasa chaudra aniva. The other options which are given in empty stomach to prevent the possible recurrence of the convulsive disorder. एतत् शुद्धवातापदानके विधानम् उक्तं संसृष्टे संसृष्टं कर्तव्यम्. If there is a samsarga, dosha samsarga, then the treatment has to be according to the dosha as such. Vegantareshu ja avapidam dadyata. In between the episodes of convulsions, avapidanasya is suggested. Tamra chuda karkata krishna matsya shishumara varaha vasashta aseveta. Vasa of these animals are birds. Tamrachuda is the cock, or so on. These birds or animals also is suggested. Kshirani va Vatahara Siddhani, Vatahara Dravya Siddha Kshiras, Yavakola Kulata Mulaka Dadi Grisa Taila Siddha va Yavagu prepared with these substances. Sneha Virechana Astapara Anuvasanishtayanam Dasharatra Ahrita Vegam Upakrameta. For 10 days after an episode, patient has been treated with Sneha, Virechana, Astapana, etc. Or in general, Vatavyadhi Chikitsan Abheksheta, Raksha Karma Kuriyat, Raksha Karma also has a role over there. Then Pakshagatopadrutam, in case of Pakshagata, Amlanagatram, Sarujam, Atmavantam, Upakaranavantam Upakrameta. The signs of better prognosis is the patient who doesn't have a maybe total depressed state, or the patient who is somewhat conscious, Mlanagatra or Amlanagatra. Amlanagatra, I would say, Glasgow Coma scale above 10 is considered as a better sign, and Mlanagatra is where it is lower, Coma scale is lower. Sarvajam Atmavantam Upakaranavantam, where the patient still is able to sense the pain and who has a willpower and of course resources also. Such a patient is to be treated. Tatra prageva snehasvedopvanna mruduna shodhanena samshodhya anuvasya astapyata यथा कालम आक्षेपक विधानेन उपचरेत वैशेषिकश्चात्र मस्तिष्कः शिरोबस्तिः अणुतैलम् अभ्यङ्गार्थे साल्वणम् उपनाहार्थे बलातैलम् अनुवासनार्थे एवम् अतन्दितः 3-4 वा मासान् क्रियापथम् उपसेवेत. In case of the Pakshagata, the main treatment would be Snehana, Svedana and Mrudushodhana, and then Astapana is to be suggested, and then all the other protocols which are used in the Akshepaka or Apatanaka earlier, they also can be used in case of Pakshagata. Specific would be Mastishka Shirobasti. Shirobasti is one, or Anutailam Bhyangarte, Anutaila Vara Abhyanga, or Salvana Upanaharte, Upartha Upanah, Salvana Lepas are used, Anumasanarte Balatailam. These are the protocols which can be considered continued for 3 to 4 months. मन्यास्तंभे अपि एतदेव विधानं विशेषतो वातश्लेष्महरैः नस्यैः रूक्षस्वेदैश्च उपचरेत. In Manyastambha, torticollis conditions too, similar protocol is suggested. Apatantraka na apatantrayet. Apatantraka is where the patient has a tetanic convulsions. In such conditions, he should not be treated with apatarpana. Vamana anuvasana asthapanani nanisheveta. Shodhana dravyas, Shodhana chikitsa is contraindicated in tetanic conditions. Vatasteshma uparuddhu uchvasam tikshnehi pratnapanehi mokshayeta. The most important aspect there would be to maintain the respiratory tract clean, and to clean the respiratory tract, Sushruta says, Vatashleshma Uparuddha Uchvasam Tikshnahi Pradmapanihi Pradmapananasya is suggested to facilitate the breathing. That's the one. Important is to maintain the ventilation. Tumburu Pushkarahva Hingu Amlavetasa Patya Lavanatrayam Yavakvatena Patum Precheta Patya Shatarde Savartela Dvipade Chaturgune Pais Sarpi Prastam Siddham Vatashleshma Apanucha Karma Kuriyata. The drugs which could be given in the form of Vatha or in the form of the Kshirapaka or Ghata are suggested, and any other protocol which is suggested in Vatasvyadhi or Kapajavyadhi are applied in case of the Apatantra calves. Then Ardhitaturam, facial palsy-like conditions, Balavantam, Atmantam, Upakarnantam, Vatavyathi Vidhanena Upacharita. In the general condition, the treatment of Ardhita, all the protocols of Vatavyathi are applied. Vaisheshikashcha, specific would be Mastishka, Shirobasti, Nasya, Dhuma, Upanaha, Sneha, Nadi, Swedadibhi, Tataha. Now, that's the protocols of Mastishka, Shirobasti also are suggested. And Tata Satranam Saha Mahapanchamulam, Kakolyadim, Bidari Gandharim, Audaka Anupamamsam, Tatheva Udaka Kandamscha Ahritya. Tata Satranam Mahapanchamulam, Kakolyadim, Bidari Gandharim, Audaka Anupamamsam, Tatheva Udaka Kandamscha Ahritya. Dvigunodake Kshiradrone Nikwatya, Kshiravasishtam Avatarya, Parisravya, Tailaprasthena Unmishya, Punaragna Adhishrayet, Tatastailam, Kshiranagatam Avatarya, Shiti Bhutam Abhimatniyat, Tata Yasneha Muttishtet, Tamadaya, Madhuraushadasaha Kshira Yuktam Vipajet, Etat Kshira Tailam, Ardhita Puranam, Panabhangadishu Upayojyam, Tailahinama Kshira Sarpi, Akshisarpadamiti. Now, one specific yoga which is mentioned is Kshira Taila, and the preparation of Kshira Taila is detailed, like where you use the Tranapanchamula, Mahapanchamula, and Kakolyagana, and so on, and they have to be prepared in the form of Kshirapaka, boiled with milk, and then Kshirapaka has to be prepared, and then it has to be again added to Taila, and again it is heated with Taila, and hence it's a Kshira Anugata this yoga. And this is considered as a Kshira Taila, which is specific for Ardhita, where it could be given Pana Abhyangadishu for internal administration as well as local administration. If the same yoga is prepared without the Taila, then it can be used for Akshitarpada. Gruthrasi Vishwati Krosuka Shira Khanja Krosuka Shiraha Khanja Pangu Vatakantaka Padadaha Padaharsha Avabahuka Badhidya Dhammanigata Vatarokeshu Yathoktam Yathokdeshan Chasira Vidham Kuryata Anyatra Avabahukata Vatavyadhi Chikitsidam Aveksheta. In other diseases like Gruthrasi Vishwati etc., Siravyadha is suggested. Of course, practically how far these can be useful, Siravyadha can be useful in such diseases, questionable. So I don't have any direct experience, so I will just keep it at that level only. Except Avabahuka, in the conditions of the frozen shoulder syndrome, Siravyadha is not to be done. And all the other protocols of Vatavyadhi Chikitsa have to be followed. Karnashureto, Shrungaberasam, Taila Madhusamsam, Saindavopahitam, Sukhostam, Karnedadhyata, Ajamutra Madhutailaniva, Matulunga Dadima Tintidika Surasa Mutra Siddham Tailam, Shukta Sura Takra Mutra Lavana Siddhamma, Nadi Swedesha Swedeta, Vatavyadhi Chikitsa Aveksheta, Buyascha Uttare Vakshamha. In the general Karnashula, application of drops, tailas, and preparation of the taila, different yogas are mentioned. And furthermore about the taila Karnavyadhi, you will see in case of in the Uttar Shalakya Tantra, the later part as such. So it's only a general protocol for the patient present with the pain in the ears. Then Tuni Pratitunyoho Snehalavanam Visnodakena Payeta, Pipalyadi Churnama, Hingu Yabakshara Pragadama Sarpihi, Basti Bishtayanam Pakameta. In the Tuni and Pratituni, a patient has to be given with the Snehalavana with the water, Pipalyadi Churna, etc. अस्थिल प्रत्यस्थीलयोः गुल्म अभ्यंतर विद्युत क्रिया विभागः. Asthila and pratyasthila have to be treated with the protocols of gulma or abhyantar vidyati. Gulma and abhyantar vidyati we will come across later on when we go into the further chikitsa sthana. Hingu, trikatu, vacha, ajamodha, dhanya, ajagandha, दाडिम, तिंटिडीक, पाठ, चित्रक, यवक्षार, सैंधव, बिड़, संवर्चल, स्वर्जिक, पिप्पली मूल, आम्लवेतस, षटी, पुष्कर मूल, हपुष, चबिय, अजाजी, पथ्याः चूर्णयित्वा मातुलुङ्गाम्लेन बहुशः परिभाव्य अक्षमात्राः गुटिकाः कारयेत्. ततः प्रातः एकैकं वातविकारी भक्षयेत्. एष योगः कास श्वास गुल्म उदर रोचक हृद्रोग आज्ञान पार्श्व उदरबस्ति शूलानाः मूत्रकचक्रीहाः अर्षस्तूनी प्रतितूनीः अपहन्ति. ब्रॉड स्पेक्ट्रम matahara yoga where these drugs are prepared in the form of a gutika, akshamatraha, one akshar size, that's one tolak size gutika, and they have to be eaten every day, which will reduce or which will prevent the diseases of kasa shwasa gulma etc. भवन्त्यात्र केवलो दोषयुक्तो वा धातुभिर्वा आवृतो अनिलः विज्ञेय लक्षणोऽभ्यां चिकित्स्यश्च अवरोधतः. The most important part in the management of Vatavyadhi is to decide whether it's a Kevala Vatavyadhi or whether there is a Samsarga. Whether there is a Samsarga, the treatment has to be different, like where the Pachana has to be given and then the Vatavyadhi Chikitsa. Whereas if it is a Kevala Vatavyadhi, the protocols of Vatavyadhi Chikitsa can be used. Then Rujavantam, Ghanam, Sheetam, Shopam, Medayito Nilaha, Karoti Esitam Vaidyam, Shothavat Sampachareta. If there is a situation of Vatavyadhi which produces a shofa with medas, that's something like lymphedema-like conditions or angioneurotic edema-like conditions where there is a shofa with vata. In such conditions, they have to be treated as a shotha. कफमेतोर्तो वायुः यदा गुरु प्रतिपद्यते तदा अंगमर्दसैमित्यवं हर्षरुजाज्वरैः निद्रया च अर्जितो स्तब्धो वात शीतलौ अप्रचेतनौ गुरुक अस्थिरौ ऊर्वु नस्वाविव मन्यते तम् ऊरुस्तम्भमित्याहुः आढ्यवातम् अथापरे. One of the possible complications of kapha-meda-avrtavata would be the urustamba, and the clinical symptoms of urustamba are the patient would have angamartha pain and numbness or maybe symptoms of pain, fever also, and the patient may have impaired consciousness like nidra, or the patient would have complete loss of movement of the limbs, and the patient would not be able to feel the limb as if it is his own. A complete loss of sensation is a characteristic feature. All those conditions like Guillain-Barré syndrome, lateral sclerosis, these are the conditions which could be considered as the urustamba. Snehavarjam pipet tatra churnam shadharanam naraha. In that condition, the choice of the treatment would be shadharana taila, shadharana churna without sneha. Hitam mustambuna tadvata pipalyadiganeh kritam लिख्याद्वा त्रैफलं चूर्णं क्षौद्रेण कटुकान्वितं मूत्रैर्वा गुग्गुलं श्रेष्ठं पिबेद्वा पिशिलाजितो ततो हन्ति कफाक्रान्तं समेतस्कं प्रभञ्जनं हृद्रोगं मृतिं तथा अभ्यन्तरविधृतिं. तीक्ष्ण चिकित्सा has to be done. Ushna Tikshna treatment has to be done, and these are the yogas which could be suggested. Sakshara Mutrastvedansha Dukshani Utsadananja Kuryad Dishyatya Mutradhi Karanja Parasashapihi Bhojyaha Purana Shana Kakodrava Uddara Shalayaha शुष्क मूलक यूषण पटोल सिरसेन जांगलेहि अघृतैहि मांसैहि शाकैश्च लवणैहि हितैहि. In general, the patient has to be given a nourishment food which is prepared with the grains like old grains, shama, kakotra, etc. And mulaka yusha without ghृta has to be given, or mamsa rasa without ghृta has to be given. यदा स्यातं परीक्षीणे भूयिश्चे कफमेतसि तदा स्नेहादिकं कर्म पुनर्त्रावचरेत. Only after the clinical signs of the reduction of the kapha and medas, snehadikarma has to be used. Now, this protocol of deciding like when the shodhana has to be given, pachana has to be given, and when the snehana has to be given is the most important issue in case of all the Vatavyadhi management. सुगंधि सुलभु सूक्ष्म तीक्ष्णोष्ण कटुकोरसे कटुपात सरोहृद्य गुग्गुलु स्निग्धपिज्जलः. The Sushruta mentions about Guggulu as one of the choice of the drugs in case of Vatavyadhi, and the property of Gugulu is mentioned here. Sanamo Brahmana Vrishya Puranastu Apakarshana. A fresh Gugulu is Brahmana and Vrishya, whereas old Gugulu is Apakarshana. Taishna Aushnyat Kapavatagna. It's a Kapavatagna because of the Tishna and Ushna Guna. Saratvat Malapittanuta, because of the Saraguna, it reduces all the doshas and Pitta. Saugandhyat Putikostagnaha, because of the smell, pleasant smell, it improves the condition of the abdomen or the gastrointestinal tract. So, Saukshma Chanala Deepana, due to the Sukshma Guda, it Agni Deepana. Tam Pratah Trifala Darvi Patola Kushavari Bhi Pibed Avapyava Mutrehi Kshire Ksharehi Usnodakenama Jirne Yusharate Kshirehi Bhujano Antimasataha. Gugulu to be taken every day with the specific substances like Kshara, Usnodaka, or the Trifala Darvi Patola Kashaya. This is suggested as one of the protocols of the treatment in all cases of Vatavyadhi, specifically Urustamba. Gulmam Meham Udavartam Mudaram Sabhagandram Krimi Kandu Aruchi Shvitrani Arbudam Grathimyaja Nadya Adhyavata Ashwayatun Kusta Dusta Pranamscha Saha Kosta Sandhyasigam Vayum Vriksham Indrashanir Yatha. This kind of a Gugulu protocol taken every day is considered to be one of the very powerful remedy for all cases of Vatavyadhi, irrespective of this location. With this, we conclude today's class, and if there are any questions. Like there is one question. For long-standing varicose vein, practically what treatment protocol can be followed? Of course, there is no question of curative treatment for varicose veins, but we can prevent the complications, and prevent the complication is again, I would prefer, practically what I do prefer is a Manjasthadik Sharabasti and continuous administration of Kaishara Gugulu and Manjasthadik Khwata as one of the somewhat efficient protocol to prevent the complications. Right. So, right, we close today.